James was the first appointment for Dr. Clark on Friday, February 19th.
Just a routine visit to go over the lab work I had done the week before.
But this visit would be anything but routine.
That was the last thing I remember, is looking at the clock, and it was 8:15.
Without any warning, no pain, no dizziness, James fell flat to the floor.
Because it just, boom, it happened right. Just sitting like this, but up on the table. And the next thing I know, I'm on a gurney with a whole bunch of people looking down at you.
He was in this room. The door was closed, and so we just heard the thud from the other side of the room. And then we came in and rushed in, and he was lying on the floor here. He was face down. I kind of shook him, asked him to wake up. He didn't wake up. Turned him over and checked his pulse, and he had no pulse. I called for help, and then started CPR because he was actually literally dead.
As Dr. Clark and his staff continued with CPR, medical assistant Chanelle Marquez rushed to get the office's Automated External Defibrillator, or AED.
And I was sitting at my desk, and I heard Dr. Clark yelling for help, so I ran over here to see him. And he was in this room, and then that's when I said, I'll go get the AED.
Chanelle came with the AED, and she was great. We didn't have to do anything. She just kind of, took the shirt off, put the paddles on, got everything set up, pushed the button to start it to go. As soon as the machine told us, to, stop CPR, we stopped CPR. It recommended a shock. It shocked him. He started to wake up.
Just then, the ambulance arrived to whisk James away to Salinas Valley Memorial's emergency room. Paramedics continued to give him CPR on the way to the hospital, and then reconnected the defibrillator once James got there. All the doctors who worked on him agree that without the AED, the story wouldn't have had a happy ending.
If I'd have been there on the job and this had happened, I don't think just plain CPR would have done it. Yeah, it took a little while, then it settled in, and you would have been dead.
When somebody goes into sudden cardiac arrest, they only have 4 to 6 minutes before their brain starts to die, before the lack of oxygen causes brain death. So our goal for the HeartSave program is to get defibrillation available within that 4 to 6 minute window to every resident and visitor in Monterey County.
Sudden cardiac arrest kills more people in America each year than lung cancer, breast cancer, prostate cancer, and AIDS combined. Nearly 450,000 people die from this type of heart disease each year.
I just want to encourage people to get the training, to know how to use this kind of equipment, because it could happen anywhere. I'd love to see the day when an AED becomes standard equipment in the back of your car along with your car jack, or we all have one in our homes, because you never know where you're going to be when an event like this occurs.
And it felt really good to shake his hand, and the first time I saw him after that, I gave him a hug, because he's here talking, and we helped save him, and it felt really good to see him and actually see that he was doing good.